Hi everyone, I'm so happy today. I've been treating this wonderful guy here for the last couple of weeks or 6 weeks, right? And he's got trouble with, you know, his shoulder, knees, lumbar, and his wrist. And so far, so you've come to Utah not to treat you, but to help your wife. But you kind of, chose to treat yourself. how you how far, how satisfied are you so far, with the treatments we had so far?
So far, very satisfied. The body's seems to be repairing itself pretty good. I feel like my back is probably 70% better. My wrist is it's really smooth now with the procedure that he's been doing. Um, and my joints seem to be coming back too. Before I had a lot of inflammation in them, and now the inflammation's gone.
Yeah.
I feel much better all around.
So one of the good things is that he was not prepared to be treated, and when he came to Brazil, we decided, and we using all the information we had, all the exams we had, and all the background he had, and using his biological response, I was doing stuff by stuff and trying to combine his biological response with what I was doing. Okay, so within 6 weeks, we got, probably 80 or more percent better than he was before, and he just got retired in the U.S. So now he's gonna be really living a good life. So one of the nicest things we did is to treat his scar. Okay, so this scar has a history, right?
Yes, pretty much so.
So he got hit with a long time ago. How many years?
So no, with this unit here, it was actually a year ago.
A year ago.
Yeah, where it severed all my tendons.
Okay, so he damaged all his tendons and everything, and the plastic surgeon, had a very nice surgery, and it's functioning and everything. But when he came out the first day, he had a very huge fibrosis, and it was limiting, his arm, plus all the things. And well, one of the nicest things I'm gonna show you guys right now and is what we did. Okay, so we did a hydrodissection plus of the scar tissue, and with this hydrodissection, we dissect the fibrosis with biological liquids, so we can release the fibrosis and make new collagen with the biotechnologies we have, depending on the biological response. And this is what he's having so far. And what are you seeing right now? So this is the scar tissue. This is one of the extended tendons that you know, was hanging with the fibrosis, and it's now released from the fibrosis. And what are we gonna do today? Okay, first time he came here like this. Stop. So what I'm gonna show you guys is that we do not need rules today. So we can use our phones to measure the angles if he's getting better or not. So the first time we did, you got 67 degrees of flexion, right?
Is that right?
Remember that? Yes. So now, if you take a look at this, he's gonna flex his. So now we got -6 uh, over 90, so he's got 84 degrees. So he got almost 17 degrees of flexion with the use of the hydrodissection and the biological response that he had so far. So I'm very grateful for him. And today we're gonna do the little bit part that still had to be released. But one of the nice things I want to show you guys, and he can tell me better, is that it's not just smooth because I think it's smooth. Since the beginning, what you were telling me,
Yeah, there was a lot of scar tissue underneath here, a lot. And since he's done that release, it seems like a lot of the scar tissue's just gone away, and it's not as hard. It's softer. It feels like there's not as much in there anymore. It feels more normal.
And remember, one of the things that, well, besides the anamnesis and besides the ultrasound, one of the things that made me do, this decision for you was the tomology with AI showing that
Yeah,
you
yeah,
didn't have any inflammation, right?
correct.
So using tomology with I could get the information that I knew that I needed to give him the best treatment. So if we understand what we're dealing with, if we will understand what the patient needs and what he wants, and plus, if we use the technology in our favor from now on, we're gonna have better results, and for sure, along the future, and using the AI just like I did with him, we're gonna help other people's lives too. So I'm very grateful for you, and today is our probably last day that we're gonna do the procedure and release a little bit more. So you guys are going to start seeing the needle right now. So I go underneath the scar tissue and using this biological liquids so we can release the scar tissue just like you see right here. So we have to see the needle itself. Any hurt? It's hurting?
No.
No? So it doesn't hurt that bad at all, but it gives us very good results. So this is the needle, so we go back a little bit, a little more pressure, a little more. So what you're seeing is the tissue moving away from the scar tissue. This is the hardest part.
I get it.
So there you go. Hold on. Hold on. Get a little bit this place here. Over here. Right. Perfect. So start. So I just got in the tissue and I'm starting to loosen it up, just like you guys are seeing right now. So when we are at the right spot, just like we saw, it kind of likes, it bumps. So now you can check during the procedure if you're releasing or not. So he was really having good response. So we're seeing that we can release the least part that was still needed to be released. Now you can stop.